There's an eye exercise so simple, so quick, that you can do it while brushing your teeth. 2 minutes. That's it. And research shows it can measurably improve how well you see. Most people have never heard of it, but once you understand how it works, you'll understand why it matters. Most people think vision loss is inevitable. You get older, your eyes get worse. That's just how it is. But here's what eye doctors are discovering. Your eyes have muscles. Just like any other muscle in your body, they can be strengthened. When you exercise your eye muscles, your vision improves. It's not magic, it's just biology. And it works. Think about your day. You probably spend most of it looking at a screen. Phone, computer, tablet. Your eyes are staring at the same distance, the same focal point, for hours. Your eye muscles get tired. They get weak. Your vision gets blurry. Then you think you need new glasses. But really, your eyes are just exhausted. They need exercise. Before we go further, I need to be clear. This video is educational information about eye exercises and vision. It's not medical advice. If you have vision problems, eye disease, or pain, see an eye doctor immediately. This information is general, not a substitute for professional eye care. Today, I want to show you an eye exercise that research shows can actually improve your vision. Not dramatically, not overnight, but measurably over time. Over the next few minutes, I'm going to walk you through exactly what this eye exercise is, why it works, how to do it correctly, how often to do it, and what to expect. I'm going to show you the research that backs it up, and I'm going to give you realistic expectations about what it can and can't do for your vision. By the time this video ends, you're going to understand why eye exercises matter. You're going to know exactly how to do this specific exercise, and you're going to know whether it's worth incorporating into your daily routine. You'll have realistic expectations about results and timeline. That's what matters. Honest information. Why eye exercises matter. Let me start with the basic anatomy. Your eyes have muscles. 6 muscles control the movement of each eye. These are called extraocular muscles. Additionally, inside your eye, there's a muscle called the ciliary muscle. This muscle controls the shape of your lens, allowing you to focus on objects at different distances. Now, here's what happens in modern life. We spend hours looking at screens. Our eyes are constantly focused at the same distance, typically about 12 to 24 inches from our face. Our ciliary muscle stays in the same position. It doesn't move. It doesn't get challenged. Over time, it becomes fatigued and less responsive. This is one reason our vision becomes blurry. Additionally, when you're focusing intently on a screen, you blink less. Your eyes become dry. The muscles controlling your eyelids get tired. Your eyes feel strained. The solution is to exercise these muscles. When you exercise your eye muscles, you increase blood flow to your eyes. You strengthen the muscles. You improve their responsiveness. Over time, your vision becomes sharper. This is not theoretical. There's actual research on this. Studies show that people who do eye exercises regularly have measurably better vision than people who don't. The beautiful thing about eye exercises is that they're free, they're safe, and you can do them anywhere. You don't need equipment. You don't need medication. You just need to know what to do and commit to doing it consistently. The 20-20-20 rule and accommodation exercises. Before I give you the specific exercise, let me explain 2 foundational concepts. The first is the 20-20-20 rule. This is incredibly simple, but incredibly effective. Every 20 minutes, look at something 20 feet away for 20 seconds. That's it. This gives your ciliary muscle a break. It allows your eyes to relax from the close focus work of screen time. Why does this work? When you look at something far away, your ciliary muscle relaxes into its resting position. Your eye is not strained. When you go back to close-up work, your ciliary muscle is refreshed. It functions better. The second concept is accommodation. This is the ability of your eye to change focus from distant objects to close objects. Your ciliary muscle does this by changing the shape of your lens. When you practice accommodation, deliberately shifting your focus from far to near, you're strengthening this muscle. These 2 concepts are the foundation of effective eye exercise. How often do you take breaks from screen work? Do you ever deliberately look away and focus on something distant? Most people don't. This is one reason your vision is declining. The specific 2-minute eye exercise. Now let me give you the specific exercise. It's called the Focusing Flexibility Exercise or Accommodation Training. Here's how you do it. Step 1. Find a quiet space where you won't be interrupted. You need 2 focal points, something close to you and something far away. Step 2. Hold your finger, a pencil, or an object about 4 inches from your face. This is your close focal point. Step 3. Behind this object, identify a distant object, ideally at least 20 feet away. This is your far focal point. A window view, a picture on the wall across the room, anything that's clearly distant. Step 4. Focus your eyes on the close object, your finger or pencil. Really look at it. Make it clear. Hold this focus for about 5 seconds. Your eyes are working to focus on this near distance. Step 5. Now shift your gaze to the distant object. Again, really focus on it. Make it clear. Hold this focus for about 5 seconds. Your eyes are relaxing and refocusing on the far distance. Step 6. Repeat this cycle. Close object, 5 seconds. Distant object, 5 seconds. Close object, 5 seconds. Distant object, 5 seconds. Do this about 10 times. This takes about 2 minutes total. Step 7. Do this exercise once daily, preferably in the morning or whenever you notice your vision getting blurry. That's it. 2 minutes. That's the entire exercise. When's the last time you deliberately focused on something far away? Can you commit to doing this simple exercise for 2 minutes daily for a month to see if it helps your vision? Why this exercise works. Let me explain the mechanism. When you focus on the close object, your ciliary muscle contracts. It's working hard. It's strengthening. When you shift to the distant object, your ciliary muscle relaxes. It's getting a break. But here's what's important. The act of shifting between distances is what trains your muscle. It's like doing a bicep curl. You contract the muscle, close focus, then relax it, far focus. You repeat. The muscle gets stronger. Additionally, this exercise forces you to be present and aware of your vision. You're noticing how your eyes feel. You're noticing what you can and can't see clearly. This awareness is valuable. The research on accommodation training shows that people who do this exercise regularly have improved focusing ability. Their vision becomes sharper, particularly at near distances. Some people report that their dependence on reading glasses decreases. Others report that their overall vision clarity improves. Now, this doesn't work for everyone, and it doesn't work for all types of vision problems. If you have significant refractive error, nearsightedness or farsightedness, this exercise won't eliminate the need for glasses, but it can improve your vision and reduce eye strain. The fact that this works, that simple eye exercises can improve vision, is really empowering. It means you have control over your eye health. You're not just at the mercy of aging or genetics. What to expect and realistic timelines. Let me be realistic about what you'll experience. Within the first few sessions, you might notice your eyes feel slightly different. They might feel a tiny bit more relaxed, or you might notice slight strain as you're using muscles that haven't been exercised. This is normal. Within 1 to 2 weeks of consistent daily practice, some people report that their vision feels slightly sharper. Their eyes feel less strained at the end of the day. They're blinking more naturally. Within 4 to 6 weeks, measurable improvements show up. If you measure your visual acuity before and after, you'll see improvement. Not dramatic. We're talking about 1 or 2 lines on a vision chart, but real improvement. Within 8 to 12 weeks, the improvements are more noticeable. Your eyes feel less tired. You don't need to squint as much. You might notice you're using your reading glasses less frequently. But here's what's important. These improvements are contingent on consistency. If you do the exercise for 2 weeks and then stop, you lose the gains. Your muscles go back to their previous state. You have to do this consistently, ideally daily, to maintain and improve your vision. Also, the improvements plateau. You don't keep improving indefinitely. But you reach a point where your vision is better and stays better as long as you keep doing the exercise. Can you commit to 2 minutes daily for at least 12 weeks? That's the real question. Most people can, but it requires discipline and consistency. Combining eye exercises with other vision-protecting practices. Eye exercises are most effective when combined with other practices that protect and support your vision. First, the 20-20-20 rule. Every 20 minutes of close work, look at something 20 feet away for 20 seconds. This prevents the eye strain that makes eye exercises less effective. Second, proper screen distance. Keep your screen about 24 inches from your face. Position it so you're looking slightly downward, not straight ahead. This reduces strain. Third, adequate blinking. When you're working on screens, you blink less. Consciously blink more often. This keeps your eyes moist and reduces strain. Fourth, good lighting. Poor lighting strains your eyes. Make sure your workspace is well lit but not glaring. Fifth, good nutrition. Your eyes need certain nutrients: lutein, zeaxanthin, vitamin C, vitamin E, omega-3 fatty acids. Eating vegetables, fish, nuts, and seeds supports your eye health. Sixth, adequate sleep. Your eyes repair themselves during sleep. 7 to 9 hours nightly is ideal. Seventh, regular eye exams. You can't diagnose all vision problems yourself. Regular exams by an eye doctor catch problems early. When you combine eye exercises with these other practices, your vision improves more dramatically than eye exercises alone. Which of these practices are you already doing? Which ones could you add? Because vision health is multifactorial. It's not just one thing, it's a combination of things. Who should do these exercises and who should be cautious? Eye exercises are safe for most people, but there are some exceptions. If you have eye disease, eye surgery, or anything more than simple refractive error, talk to your eye doctor before starting eye exercises. Some conditions can be aggravated by accommodation training. If you have eye strain or tension headaches, eye exercises can actually help. But if you have pain, see an eye doctor first. If you wear glasses or contacts, you can do these exercises with your correction on. In fact, it's better to do them with your correction because you can see clearly. If you have cataracts or macular degeneration, eye exercises alone won't fix these problems. You need professional eye care. But eye exercises can be a helpful adjunct to other treatments. The vast majority of people with normal, healthy eyes who just want to improve their vision or reduce eye strain, can safely and benefit from eye exercises. The fact that something this simple can improve your vision is remarkable. It doesn't cost anything. It doesn't require special equipment. It just requires commitment. And that's something everyone can do. The science behind eye exercises. Let me give you the research background so you understand this isn't just anecdotal. There are multiple studies on accommodation training. One study published in Investigative Ophthalmology and Visual Science found that accommodation training improved focusing ability and reduced accommodation lag. The difference between where your eyes are trying to focus and where they actually focus. Another study found that eye exercises improved visual acuity in people with presbyopia, age-related focusing problems. There's research showing that eye exercises help with computer vision syndrome, the eye strain from excessive screen use. There's research showing that combining accommodation training with other vision therapies is particularly effective. Now, the research isn't saying that eye exercises cure blindness or eliminate the need for glasses in people with significant refractive error. But it's showing that eye exercises do improve vision function, reduce strain, and help your eyes work more efficiently. This is solid research. It's not controversial. Eye exercises work. I want to know, are you going to try this exercise? Will you commit to 2 minutes daily for a month and report back on what happens? Or have you already done eye exercises and noticed a difference? Drop it in the comments. Because real experiences, not marketing hype, but actual results from real people, are what inspire others to take action. I need to be clear. This video provides educational information about eye exercises. Eye exercises can improve vision function and reduce eye strain, but they're not a cure for vision problems or eye diseases. If you have vision loss, eye pain, flashing lights, floaters, or any eye concerns, see an eye doctor immediately. This is not a substitute for professional eye care. Before starting any new routine, especially if you have eye conditions or take medications, consult with your healthcare provider. Your eye doctor can determine if eye exercises are appropriate for your specific situation and can monitor your progress. You know what I love about eye exercises? They put you back in control. You're not just passively accepting declining vision, you're actively doing something to improve it. And it works. Not overnight, not magically, but consistently and measurably. 2 minutes a day. That's such a small investment of time for such a significant return. Better vision, less eye strain, and the knowledge that you're protecting your eyesight for the future. I'll see you next time.